Hi everybody, this is Dr. Sham. I am a rheumatologist practicing in Chennai. So we are talking about various arthritis. I was talking about the common ones like rheumatoid, spondyloarthritis, psoriatic, gout. See, there is a rare group of diseases called connective tissue disorders. These are important because some of them can cause severe type of illness. So connective tissue disorders, the last three ones are also what we call vasculitis. So in these, patients can have multiple involvement. They can have fever, oral ulcer, they can have rashes, they can have a lung involvement, they can have a kidney involvement. Like any of the organs can be involved. Like in rheumatoid, usually it is in the late stage or people with who are disease is not properly controlled, they can have other organ involvement. Whereas here, even upfront, the other organ involvement can be there. So arthritis, as I told, is like fever. It's just a symptom or a sign. It can be seen even in these patients. So sometimes, particularly young females, if you see somebody has arthritis, you see the rheumatoid factor is negative, you see the anti-CCP is negative. If they have associated things like an oral ulcer, hair loss, once they go out in the sun, they might have a rash here. Some people can have skin thickening, they can have dry eyes, dry mouth, or muscle pain, muscle weakness, or like mosquito bites, they can have a rash over the legs, or a blood test show ESRSI, some protein is there in the urine. So these are some of the things where you have to think in terms of a connective tissue disorder or other group called vasculitis. These are little bit complicated illness or severe illness where you should be careful and look out for other organ involvement. Why I wanted to present this video was just to tell all arthritis need not be just a rheumatoid arthritis, spondyloarthritis. We also should be careful that we shouldn't, particularly it's more common in young females like SLE, scleroderma, all these things. Even rheumatoid arthritis also is a connective tissue disorder, but other than rheumatoid arthritis, there are few other rare types of connective tissue disorders which we have to be more careful, because delayed pickup, there is more chance that the chances of extra articular or other joint getting, other parts getting involved will be more, like they can have an ILD, more chances of them developing ILD, or something like pulmonary hypertension or a kidney involvement. So these things can be more in those patients. So arthritis can also be seen in other connective tissue disorders like SLE, scleroderma, Sjogren's, and even vasculitis. Like the main problem is to do with blood vessels, but even they can have arthritis. There are other rare diseases like sarcoidosis, something called IgG4 disease. There are so many diseases. In any of these autoimmune or rheumatic diseases, you can have arthritis as one of the presenting manifestation or an associated manifestation. So all those things also have to be thought of. So usually the treatment of arthritis, whether it's going to be rheumatoid or whether it's in SLE or whether it's in Sjogren's, treatment is going to be the same. So usually the treatment in rheumatic diseases is not based on the disease name, it is based on the which system which is involved. So that is very important. So the main idea of presenting in these videos, there are some rare rheumatic diseases which also can present with arthritis. So it's not just about rheumatoid and other which we discussed in the prior videos. Thank you.